At BW Furlong and Associates, we have recently added a variety of regenerative medicine therapies to our long list of services. These therapies enable the horse's body to repair, replace, restore, and regenerate damaged or diseased cells. Dr. Sarah Gold has spearheaded this effort.
So basically at BW Furlong and Associates, we see many performance horse injuries, which can be joints, it can be soft tissue, ligaments, tendons, etc. And one of the issues that we have in horses, because they're so big, is to get them to heal quickly and in a way that's biomechanically useful, so you don't get a whole lot of scar tissue in there. And when you get an injury, you wind up having a very catabolic environment. There's a lot of breakdown of tissues, breakdown of vessels, and that's a perfect environment to get scar tissue formation, which then if you go back out and you try to race or jump or whichever the horse's job is, you're going to wind up having secondary injuries, you're going to wind up re-injuring the structure. And when we introduce these therapies, we actually create an environment which is an anabolic environment, which is a healthy environment, where you can have cells come in and actually lay down more natural tissues, more biomechanical friendly tissues, and the horse can go back to its job with very little risk of re-injury and often get back to it a lot faster.
Currently, we offer 4 different regenerative medicine therapies: PRP, platelet-rich plasma therapy, bone marrow aspirate therapy, cultured stem cell therapy, and embryonic stem cell therapy. The last 3 of these therapies involve the use of stem cells. PRP therapy is a same-day procedure commonly used to treat tendon and ligament injuries. Blood is drawn from the horse and the platelet-rich plasma is separated out from the blood using a state-of-the-art Magellan autologous platelet separator system. You have the highest concentration of growth factors available to you. When this machine is compared to other machines, you get very, very high concentrations of these growth factors, which is what we're so interested in trying to get healing to happen. Using ultrasound to guide the injection, the separated PRP is injected directly into the problem-causing lesion. The injected platelets adhere to the lesion, then growth factors trigger cells in that area to begin healing the injury. PRP, or platelet-rich plasma, is a product that's derived from the horse's own blood, and what happens with platelets is that when they're activated, we get a huge release of growth factors and things that can be very helpful in healing a lot of these different issues. And it's a simple procedure. It comes simply from the horse, and it's been traditionally used for soft tissue problems, ligament, tendon injuries, and such. But we've recently started using it in joints and had some very promising results. The first of the stem cell therapies is bone marrow aspirate therapy, where marrow is drawn from the horse. Although it can be drawn from the horse's hip, on adult horses it's most often taken from the sternum. And that product is the actual bone marrow aspirate, and what we do with that is spin it down in a centrifuge and put it through our PRP machine to concentrate all the growth and healing factors, and then go ahead and inject it into various different injuries. This modality is not used quite so much for joints, but we do use it quite extensively in soft tissue injuries. Similar to bone marrow aspirate therapy is cultured stem cell therapy. The difference is the drawn marrow is sent out to a lab where the stem cells and growth factors are concentrated and cultured. It's then returned to BW Furlong and Associates for injection into the injured area. What they do is, if you think about the healing process as an orchestra, these are the conductors, and they organize and call in blood vessels and more healing factors and more for the horse's own body to help with healing, and you just create an entire environment for healing, for comfort. And we find that when we re-ultrasound these horses, in very short periods of time, these horses are getting tissues back that look more physiologically normal instead of scar tissue. Another variation of stem cell therapy involves injecting embryonic cells into the area of injury. The difference here is that the embryonic cells need not come from the injured horse. Instead, the cells are purchased from a lab that has a supply of them available.
They come to us in a couple of days, and very early evidence has shown these cells to be very, very useful in the healing of different soft tissue injuries.
At BW Furlong & Associates, we're committed to being a leader in the use of regenerative medicine for the treatment of equine injuries.
So with all these different options available to you, it's definitely very important that you have a conversation with your own veterinarian about your own particular case to choose the option that is most appropriate for treating your horse.